Xanax is one of the most commonly prescribed benzodiazepines for anxiety, and over 17 million prescriptions are written for it each year. So in this video, we're going to break down the must-know facts about this medication so that you can be better informed when deciding whether or not to start it. And believe me, this is going to be one of those videos where you're going to want to stick around to the end because I'm going to give you my unfiltered opinion about this medication. So Xanax was first approved for medical use in the United States in 1981. So it's been around for quite a while now. And the first thing I need you to know about this medication is that it goes by two different names, and doctors will often use these names interchangeably. So Xanax is the brand name and Alprazolam is the generic name. Now, how does this medication work? Xanax is considered to be a benzodiazepine, and sometimes people will also refer to it as an anxiolytic or a sedative. It works by calming down certain parts of the brain that become too excitable in people with anxiety. And specifically, it works on the neurotransmitter GABA. So what does Xanax treat? Well, it's FDA approved in adults for the short-term treatment of generalized anxiety disorder and panic disorder. It's not approved for the use in kids, and some off-label uses include other types of anxiety disorders, such as maybe social anxiety or anxiety affiliated with depressive disorders. It's also commonly used off-label for premenstrual dysphoric disorder, insomnia, acute mania, acute psychosis, and catatonia. Okay, now let's talk about the different formulations and how it's dosed. The immediate release and extended release tablets are the most commonly prescribed. However, Xanax is also available as an oral solution or as a dissolvable tablet. So when dosing the immediate release version, the starting dose is generally between 0.25 to 0.5 milligrams 1 to 3 times daily, and this dose can be increased every 3 to 4 days, and the max dose is 4 milligrams if being used to treat generalized anxiety, and 1 milligram if being used for panic. For the extended release version, dosing starts at 1 milligram per day, and the max dose is between 4 to 6 milligrams daily. Now, it's important to remember that the goal is to find the lowest effective dose and to use this medication for the shortest period of time. So, a big question that I'm commonly asked is how long does it take for this medication to start working? And I get it, because if you're someone who is having a panic attack, you want these symptoms to go away immediately. Xanax is one of the fastest acting benzodiazepines, and it reaches peak concentrations relatively quickly. However, the caveat to this is that it also has a short duration of action. So basically what this means is quick in and quick out, and this sucks for a lot of people. What we see is that in the moment, symptoms of anxiety are managed really well. However, it's only a fleeting and temporary improvement because with it leaving the system so quickly, patients often have breakthrough anxiety between doses, and sometimes this anxiety is worse than the original anxiety that you had prior to taking the medication. Then what we see is a snowball effect, right? Because that rebound anxiety pops back up again and is worse in severity. And then what you'll want to do is take another Xanax, and then this happens over and over again. And before you know it, you're taking more medication than's being prescribed you, and your risk of becoming addicted and dependent skyrockets. And then when you realize you're struggling with Xanax use or abuse, and you want to come off of it, you're at high risk for withdrawal symptoms, which will be discussed more in a minute. But first, let's talk about potential side effects. The most commonly reported side effect of the benzodiazepine class as a whole is drowsiness, and this occurs in about 10% of people. Other commonly reported symptoms from Xanax include slurring of words, impaired coordination, forgetfulness and memory impairment, decreases in blood pressure, and changes in sex drive. One of the most serious side effects is its potential to cause respiratory depression and death, and this is especially true if you're taking Xanax with opioid medication. There's actually a big, bold warning on the FDA label that states that use of benzodiazepines and opioids together may result in profound sedation, respiratory depression, coma, and death. There have been observational studies that have demonstrated that mixing opioids and benzodiazepines increases the risk of drug-related mortality compared to the use of either alone. Another big thing to take into consideration is that Xanax has a high risk of abuse, misuse, and addiction, and this can lead to overdose and death as well. Remember, benzodiazepines are Schedule IV controlled substances. Xanax can also put people at high risk of falls, particularly the elderly, and it can cause paradoxical reactions where instead of the medication calming you, it can actually make you more irritable, agitated, or aggressive. Then you also have to be cautious when taking these medications if you're driving, because benzodiazepines can cause impairments in coordination and mental alertness. Now, how long should someone be on Xanax for? The goal with this medication is to be on it for the shortest duration as possible. So it's not uncommon for people to take it for only a few weeks. This allows a primary medication, such as an SSRI, to build up in the system and to cause the nervous system to become less excitable. Or it allows someone to get therapy started and learn new ways to cope with anxiety. Just remember, it's not known if Xanax is safe and effective when used to treat generalized anxiety for longer than 4 months, or panic disorder longer than 10 weeks. So how do you come off of this medication? This is one of the most important topics that I need you to know about. You're at high risk of experiencing withdrawal symptoms with dose reductions if you're someone who is on a higher end dosing wise, or if you're someone who's been taking this medication for a long time. And mild symptoms of withdrawal can include things such as diarrhea, muscle cramping and twitching, decreased appetite, blurred vision, clouded sensorium, and heightened sense of perception. However, the biggest thing you need to know is that abrupt discontinuation or rapid dosage reductions can produce seizures and life-threatening withdrawal reactions. So we need to taper this medication very slowly, okay? The FDA label states that the dose of Xanax should not be decreased by more than 0.5 milligrams every 3 days. However, okay, in my clinical experience, this is way too fast for most people. And at most, I'll generally do around a 10% reduction every few weeks. And I've even gone as low as 1% dose reductions. I cannot stress the importance enough of making sure to work with your doctor when you decide to come off of Xanax. Okay, so now you're wondering, what are my thoughts about this medication? So what I'm going to tell you is that this medication is easily in my top 3 psych meds that I dislike the most, okay? The mechanism of it being quick in and quick out makes it really unappealing because of those breakthrough symptoms of anxiety that we talked about earlier. It can be highly addictive, right? Even for people who don't have a history of substance abuse issues. And then not only that, the side effect profile of it just kind of sucks, right? Because if you're someone that's looking to be functional when it comes to work performance or the ability to learn new information, say if you're a student, right? You have the issue of memory impairment, and it interferes with your ability to learn new things. And if you're someone who's more prone to having big emotions, it can be really disinhibiting and cause you to be more reactive. So we're talking more aggressive symptoms, more agitation, and more irritability. And then on top of that, if you're elderly, you have at least a 50% greater risk of falling. You shouldn't drive when taking it because you can get a DUI, and then the list goes on and on. So in my opinion, this is one of those medications where the risk outweighs the benefit for the vast majority of people. Frankly, if they just stopped making this medication, I'd be completely fine with it because there are a ton of better options and alternatives out there. Now, if you're looking to learn more about a safer medication option to treat symptoms of anxiety, make sure to click that top video.